Hi, my name is Lindsay McGee and I am the Waiver Manager at the Bureau of Developmental Services, BDS. These recorded training sessions are intended to provide information on each service available on the Developmental Disabilities, DD Waiver, Acquired Brain Disorder, ABD Waiver, and the In-Home Supports, IHS Waiver. In this session, we will be discussing consultations. We will describe the service, talk about a scenario, and then provide any additional information that may be important to know about the service. The information in this session is applicable to the In-Home Supports Waiver. How does the In-Home Supports Waiver define consultations? The In-Home Supports Waiver defines consultations as evaluation, training, mentoring, or special instruction which maximize the ability of the service provider, family, and or other caregivers of a specific child to understand and care for that child's developmental, functional, health, and behavioral needs. So what does this really mean and how does this help me achieve my goals? Consultation services help families and caregivers learn how to best support a child's growth and well-being. This service includes teaching and guidance to understand and meet that child's developmental, health, and behavioral needs. Next, we will walk through a fictional scenario for consultations. Here's some background. Max is a 5-year-old boy who loves cars and was recently diagnosed with autism. As this is a new diagnosis, his parents are interested in learning about Max's specific needs and how they can best support him at home. He finds it a bit hard to communicate as well, and his parents want to help him however they can. So how do Max and his parents access consultations? Max's parents took him to a local autism center where specialists checked how he was doing. They found out that Max could use some extra help with speaking and understanding, so they suggested he try out speech therapy. Max started visiting Ms. Emily, a speech therapist, who used fun games and activities to help him learn new words and understand better. The Autism Center worked with Max's parents to better understand his diagnosis and suggested ways that they could support him at home. The center also supported Max's family by attending meetings with his in-home supports team. So what was the outcome of this service? As time went on, Max began using more words and could follow simple instructions more easily. He felt happier and more confident when playing with other kids and loved showing his parents what he had learned. With the support of the Autism Center, Max's family felt more knowledgeable and confident in their ability to support Max at home. They even joined their local family support council to help other families by passing on what they had learned. Lastly, we will discuss any service limits and requirements that must be included in the individual service agreement. We will also discuss if this service may be provided remotely or while in an acute care setting. When a service can be offered remotely, it means you don't have to be physically present at a specific location to use it. When services can be accessed in acute care, it means that individuals who are in a hospital or another urgent care type facility can still receive these important services. When waivered services have limits, it means there are specific restrictions or caps on the type, amount, or cost of the service that can be provided. For consultations specifically, there is a limit of 100 hours per calendar year. However, this limit may be exceeded with prior approval from BDS. Consultations may not be provided remotely, however, they may be provided in an acute care setting. For the service agreement, there needs to be a description of how the service will be used in the service agreement. Thank you. If you have any additional questions about consultations, please email bds@dhhs.nh.gov.